now the bronchiectasis is because the inhalers were not going in consistently. You have progressed to the point where the phlegm just sits there. It widens, it widens, it widens. The phlegm comes there. You give it an antibiotic. You probably keep some and you have some in stock. You don't even need to see Dr. Mkono about it, right? And you keep it and use whenever you want. And guess what? They bruise and bruise and bruise. And you see these cups forming. You start getting multiple cups. I should put a handle on it. And I'm being serious. Now you have the big tubes. They're supposed to be teeny tiny tubes that I drew on the other side. You see that? Now you have these big, huge tubes. They're like, they can't function. They're destroyed. Yes, I'm not being funny here. I'm actually being very serious. And now you have all this rattly and you're like, oh, it's Dr. Mkono's. It's not Dr. Mkono's fault. Your process began where we talked about it, where it is asthma, maybe mild, and you know, you can control it. You're doing herbs, I'm not beating on the herbs. I'm just telling you, be careful, because the destruction happens. The herbs are not going to be the one telling you that you did the herbs. You're obviously not even going to tell the doctor you did the herbs. So when you're doing the herbs, tell your doctor so they can maybe do this demonstration with you and tell you if it's worth it for you, right? Look up some pictures. You may see CAT scan like this, which is normal, and then you may see CAT scan like that. Maybe look it up and see. And it's scary. You don't even need to see a radiologist to know that this CAT scan is worse than that CAT scan, right? So these things are very accessible. You can cross-check me, double-check me, triple-check me. They may not have the terms I use, but they'll explain it to you in a medical term to tell you that now you have cups. Now you have airways that are looking the same. The trunk, you can't see the difference between the trunk of the tree and the leaves of the tree. Everything looks the same. And now you have cups. And of course, the pooling happens. And it settles in there and the bugs come in from the air. They swim around from your nose to another person's nose all the time, which is why I tell you mask up. For those people who are sick all the time, mask up, for God's sake. Because if the phlegm is going to be infected, you have a pool. You have a septic pool, right? You're not supposed to have the septic pool here. It's going to be in your lungs. And sometimes it even smells. Yes, it does. Because some of you have it in your nose and sinuses. I talked about it the other day. You know, this is the thing. So you now know what I'm saying. You can find the medical terms, match it with it. But I'm just telling you, now the phlegm is very infected, completely a disaster. The bugs have gotten smarter. You have a septic tank on this lung. And we call it bronchiectasis. Yes, I would say it's bronchiectasis. Septic tank are the same. Why? Because you have a lung that is destroyed, full of bugs, microbes. Yes, is that going to be a better term for you? And those microbes, you can take antibiotics over and over again, but they eventually get smart. And now you have resistant bugs. And you're so concerned about it being called Pseudomonas, and you don't realize it's also bronchiectasis and Pseudomonas together. And it's just the same thing. Uncontrolled asthma, uncontrolled COPD can cause that because of the phlegm. Anything, repeated pneumonias can cause it. So find out why you're having repeated pneumonia. Is it asthma? A repeated bronchiectasis? Just harboring that phlegm. Whatever causes you to do this, I am seriously talking to the asthmatics and the COPDers who have management that they should be following and they're not. Listen, please be serious about everything, because once you get here, you're rattling, you're blaming everybody. You're not even discussing what you did not do. We are now talking about how Dr. So-and-so did not prescribe so-and-so, but you don't talk about how you never used the inhalers in the first place, and they're not helping you. If they come up with a better plan, I'll tell you, but for right now, it is the plan of inhalers. Whether you have severe or mild, you're on inhalers, and you're supposed to be. Whether they've upgraded you to the new and upcoming therapies, yes, the injections, you're supposed to be on inhalers. I'm just here. We want to talk about you before you develop the cups that I'm discussing here and the septic tank, to be serious. And I am here to educate you. And I hope this is of value. And if it is, please mark it. Nobody will know you're marking it. And please save it for the future. Share it with somebody who needs it. And definitely come back and let me know that I'm not wasting my time on here talking to you. I hope this is helpful. My name is Dr. Mkono, and I am just really needing you to understand bronchiectasis is real. It's not something we should joke around, and we should take it seriously before it becomes a septic tank and cups